Good morning. Thanks for joining us for our webinar today. This is the fifth and final webinar of 2018 in a series of webinars covering workflow-specific examples of how GIS can combat fraud, waste, and abuse. We will leave some time at the end for questions and answers. We don't mind if we go over time. Today's webinar will cover how we can use GIS to combat the opioid epidemic. Opioid abuse is destroying lives, devastating families, and communities across the United States. One pill can kill, one pill can cause addiction. Addiction and overdoses are happening in communities from all backgrounds, all ages, in both men and women. According to the National Institutes of Health, more than 115 people in the United States die after overdosing on opioids every day, and more than 1,000 people are treated in emergency departments for misusing prescription opioids. The CDC estimates that the total economic burden of prescription opioid misuse in the U.S. is $78.5 billion a year, including the cost of health care, lost productivity, addiction treatment, and criminal justice involvement. This crisis is pressing, it's personal, and it's heartbreaking. So how do we tackle such an immense problem? Where do we start? After looking at broad statistics, it's easy to see that a main factor in the opioid epidemic is the fraudulent prescribing and distribution of prescription opioids. It seems that misuse of prescription opioids is fueling this epidemic in two key ways. The first is by causing direct opioid-induced deaths. More than 40% of all U.S. opioid overdose deaths in 2016 involved a prescription opioid. The second way is by prescription opioids becoming a gateway to addiction and other opioid substances, such as heroin and fentanyl. Roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them. Between 8 and 12% develop an opioid use disorder. An estimated 4 to 6% who misuse prescription opioids transition to heroin. About 80% of people who use heroin first misuse prescription opioids. Using data analytics and mapping, we can identify high concentrations of potential opioid diversion. A top priority is mapping the location of high prescribers, doctors, pharmacists, and other medical professions who might be corrupted by greed. Now we'll pass this on to Patrick. Patrick is going to walk us through some examples of how GIS can be used to combat the opioid epidemic.
Thank you, Scott. As Scott mentioned, this is our final webinar for 2018, looking at how GIS can combat the opioid epidemic. What we're going to focus in on is three key areas using GIS to combat opioid fraud. First, we will explore how GIS can understand trends in information. Next, we will find how we can use spatial analytics to find outliers within our data. And finally, how we can automate that analysis. As Scott mentioned, the opioid epidemic is an imperative mission across the United States in all levels, from federal, state, and local, as well as healthcare units. ArcGIS is used to identify high concentrations of potential opioid diversion, and we are using the power of data and analytics to map trends, identify risk areas, and detect fraud schemes in this epidemic. So instead of talking about more statistics, let's go ahead and jump in to see how we are using ArcGIS to combat the opioid epidemic. So here I'm using Insights for ArcGIS. Insights is a data analytic capability application within the ArcGIS platform that allows for deep data analysis and discovery. So I've added in some information from the CDC related to opioid deaths due to overdose. So as you can see, we have two different maps and two different charts on the screens. So in blue, we have the number of opioid deaths per state due to overdose. And in purple, we have the opioid death rate per 100,000 people. This is a very easy analytic capability to build out, and it is entirely interactive. So when I click on one section of a chart or a map, it will highlight that section in the rest of the page. So here, looking at the number of opioid deaths due to overdose, state by state, we can see that Florida has the highest number of opioid deaths due to overdose at about 4,700 people in 2016. California is the second highest, but as you can see, it has a very, very low opioid death rate per 100,000 people. The third highest number of opioid deaths due to overdose per state is the state of Pennsylvania, where it has a very high number of deaths of 6,227 people in 1 year. And it also has the fifth highest opioid death rate per 100,000 people, with 38 people dying of opioid overdoses per 100,000 people in a given year. So let's take a deeper look into these physicians in Pennsylvania. So I've grabbed some information from CMS's website on physician prescribing rates. So we can go ahead and take this data that we have and map it using Insights for ArcGIS. It is simple as dragging and dropping the data that I want to visualize into Insights. From there, I can style this information the way that I want. Instead of looking at the location of all of these providers, I can look at information such as the total number of opioid claims in a given year. Insights also allows us to do charting capability. So I can take information that I might want to understand, such as the different specialties of these physicians and the sum of opioid claims in the state of Pennsylvania. I can drag these variables over and choose what type of chart that I want to visualize this information in. For this information, I might want to visualize this in a tree chart. So looking at this tree chart, it's very easy for me to see the different breakdowns of the specialties of physicians and the total number of opioid claims for these specialties. So family practice physicians have the highest number of opioid claims in the state of Pennsylvania. I'll classify this information by the number of physicians in each specialty. So it might be understandable to see that family practice physicians have the highest sum of opioid claims because those are the most physician specialties within the state. So what I also want to do is try to find some outliers. So I'm going to take each physician. I'm going to take the total number of opioid claims and their opioid prescribing rates. And instead of visualizing this in a table or visualizing this in a chart, I'm going to visualize this in a very simple table. Another capability within Insights is enabling cross filters. So when I filter information in one view, it will filter the rest of my cards within my workbook. So here, if I click on family practice physicians, you can notice that the chart and the table, or the map and the table, have also filtered for just the family practice physicians. I'm going to sort these physicians by the total number of opioid claims. And as we can see, this physician with the NPI number starting with 104 had a total number of opioid claims in 2017 of 4,991. That is over 1,500 more opioid claims than the next closest physician of the same specialty. His prescribing rate is also about 20%, which, as we can look at, it is extremely high for a family practice physician. Well, in December of last year, this physician was indicted by a federal grand jury on a 19-count indictment, charging the unlawful distribution and dispensing of controlled substances, causing the death of 5 patients by the unlawful distribution and dispensing of controlled substances, and maintaining 2 drug-involved premises in Mount Carmel and Shamokin, Pennsylvania. So as you can see, using Insights for ArcGIS, we have very easily been able to burn down that haystack, starting at a national level, information of opioid deaths per state. We have focused in on the state of Pennsylvania and have very easily been able to use mapping and charting in Insights for ArcGIS to find a certain outlier. Now I'm using historic data here, so I was able to use historic data to find the outlier and come to find out that this physician has already been stricken and indicted. So a new capability within Insights is the ability to do link charting. So I'm going to move into a different page within my Insights workbook. So here I have a new data set, and I can show you that data set in a CSV. So instead of looking at trends using charts on Insights for ArcGIS, I might want to do some more location analytics. So I want to know what patients are visiting what doctors. So as you can see here, we have a beneficiary ID and the doctor that they visited for an opioid prescription. We also have another variable of the total number of visits to that specific doctor, the number of prescriptions that the doctor prescribed that physician. And we also have latitude and longitude for both the patient and the physician. So I've already brought this information over to Insights, but now I need to spatially enable this. So I'm going to enable location, and I'm going to tell Insights that I want to locate each of these points for the patients. So I have the X patient value and the Y patient value, and I'm going to click run. What this will do is this will take those coordinates and map those coordinates for the patient location within that spreadsheet. I'm also going to do the exact same thing of enabling location for the latitude and longitude of the doctor's location. I'm going to click run. And I'm going to rename these fields for the patient location and the doctor location. So now within the same data set, I have two different location variables. And if I want to visualize those at the same time, I can select those two variables, drag it and drop it into Insights into a map. So what this will do is this will create links for me. And as we can see, if I expand this view, we can see that this has created links from each physician to each of their beneficiaries for opioid prescriptions. I can then do some simple visualization. So maybe I want to have the doctors more visible. So I'm going to change their location to red circles. And I'm going to change the size of these locations. I'm going to leave the patients as blue dots. And I can also add a directional flow. So as we can see, we can visualize each of these physicians and the prescriptions and the location of the beneficiaries that they wrote those prescriptions to. I can then style these links. So I can weight these links on the total number of visits each patient went to each physician for an opioid prescription. So as you can see, it added a thickness to the line. I can then add some more visualization techniques by styling each line by the specific doctor that was visited. So as you can see here, we have been able to very easily create a link map within Insights for ArcGIS, giving us a very, very beneficial view of the prescribing habits for each one of these physicians. I'm going to change my base map color to a dark gray base map that might be more visually appealing. So now I want to continue my link analysis. So what I can do is I can take each beneficiary to each doctor, drag it and create a new chart. And as you can see, I have a new chart type, which is a link chart. Now Insights has the capability to do link charting capabilities and link analysis. So once again, I'm going to change these locations to mirror my map. So I'm going to have each beneficiary in blue, and I'll change their size. I'm going to have each doctor in red. And the size of the dot indicates the total number of visits for each physician. So larger doctors, larger dots in this link chart indicate physicians that have been visited more than others. I can then change the type of visualization that I want to see. So here I am looking at a force direction link chart capability. This will automatically rearrange each of these locations to try to fit within a screen in a cohesive manner. But I can also apply different types of link charting capabilities, such as hierarchical charting, which isn't beneficial for this type of analysis. But a radial analysis might be the most useful link charting capability for this analysis that I'm doing. I'm also going to create one very simple chart. I'm going to create a very simple column chart indicating each beneficiary's unique identifier and the total number of opioid prescriptions that they received. I'm simply going to change each style to match my map and my link chart. And I'm going to sort each of my beneficiaries. So here I just created a couple of different graphics. I created a map very easily, being able to create a connection from the beneficiary to their physicians. I've been able to visualize that in a link chart and also a very simple bar chart. This gives me a couple of different visualization techniques that allow me to find some answers. This allows me to find patterns within my information. So as we can see here in the middle, we have Dr. James Miller. This physician here is in the middle of my radial link chart. So this physician is connected to other physicians and other many beneficiaries within this data set. And as you can see on the outside, Dr. Carl Walter has a very organized prescribing habit. So that person is being sent to the outside with very few total number of opioid prescriptions written. But within this data set, Dr. James Miller looks to be extremely fraudulent. I can also look at each beneficiary and the total number of visits that each of these beneficiaries went to. So as I can see here that beneficiary number 10 has a total of 61 visits within my data set. I can then look at this beneficiary individually to see how many times this beneficiary visited each of these doctors. So beneficiary number 10 visited Dr. Max Reed a total of 1 time. Also visited Dr. Jonathan Shipp 1 time. Dr. Michelle Smith 1 time. Dr. Vita Kuthu 1 time. And Dr. James Miller. So I can identify this beneficiary as a potential doctor shopper. So this type of link analysis capability is new to the ArcGIS platform by Insights for ArcGIS. So I've been able to very easily take a spreadsheet of information, drop that spreadsheet into Insights for ArcGIS to find patterns of these prescribing habits. So in this analysis, Dr. James Miller seems to be extremely fraudulent and someone who is potentially defrauding the healthcare system and fueling the opioid epidemic. So that is in a brief sense how we can use Insights for ArcGIS to identify patterns and identify outliers fueling the opioid epidemic. The next analysis I want to explain is a very simple distance analysis that will allow us to, in the end, automate this workflow so we don't have to go through the same clicks once again. Now within Insights for ArcGIS, I have applied this analysis to a very small data set. But if I receive another data set, I can apply this same analysis to any other data set that is similar, because Insights has tracked my analysis. So as you can see here, we added a data set to my Insights page. We ran a location for the patient location. We also ran a location for the doctor's location and did 3 types of analysis. We created a bar chart, we created a link map, and we created a link chart. So if I want to apply this analysis and this insights to a different data set, all I have to do is change my data set here, click update, and then I will get the same visualization and same link analysis as I've already performed. Another way to automate workflows is by understanding the GIS steps and being able to put that into a Python script or a model to be able to automate that workflow. So here what we're going to view is a distance analysis to a pharmacy. So we all know that we can use GIS to understand networks. So here we're looking at a physician and their opioid prescriptions. But what we want to ask the question here is, instead of understanding who a physician wrote prescriptions to, I might want to understand where are these prescriptions getting filled. So some simple questions that I can ask using GIS are, how far are people traveling to one pharmacy? How many other pharmacies are closer by in drive time to these beneficiaries? Which will then give me the final question, how many pharmacies did they likely pass on the way to fill their opioid prescription? This analysis can be done very simply. So we use network analysis, a desktop analysis, to run a distance analysis for each pharmacy. So of those patients, how far did each patient travel to a specific pharmacy? And looking at this map, it obviously leads us to an outlier. This outlier is at the corner drugstore in Cartugus, New York, where people are driving an average of 21 miles to fill their opioid prescriptions at this specific pharmacy. So now I want to go back and ask those questions. How many pharmacies did they likely pass? How many pharmacies are closer by to the beneficiary's home? So let's look at a single patient. So we're going to take this single patient and do some very simple analysis. We're going to create an optimized drive time for this one patient and buffer that optimized drive time by 3 miles. We are then going to create a 15-minute drive time from the beneficiary's home, figuring any pharmacy within that boundary is likely closer to that beneficiary's home. And we then dissolve those two boundaries, being able to allow us to select the pharmacies within that region. Now, any pharmacy within this region is likely closer to the beneficiary's home, or potentially that the beneficiary passed on the way to fill their opioid prescription at the corner drugstore. So I've been able to go through the simple GIS steps to allow me to answer that question for one single beneficiary. But that analysis can be put into a model, so we can automate those GIS processes for all of the beneficiaries within this pharmacy's network. This will allow me to come up with a new variable. This new variable is, on average, how many pharmacies were either likely closer to the beneficiary's home, or did they likely pass on the way to fill a opioid prescription at the corner drugstore? And when we look at the aggregate of all of these pharmacies in this area, we can see that the corner drugstore has a very high total average number of pharmacies passed to fill an opioid prescription at the specific pharmacy. Now, this analysis is not specific to just pharmacies. We can apply this same exact analysis to physicians, or filter those physicians by the physician type. So maybe someone is seeing a family practice physician, but we also want to run this analysis for physicians such as dentist or oncologist or a podiatrist, to identify these outliers. How far are people traveling to visit that one physician, and how many physicians are they passing to receive an opioid prescription? So right now we're doing this analysis in Western New York. So where we buffered the optimized drive time by 3 miles, we also created a 15-minute drive time from the beneficiary's home. Within that model, we can change those parameters depending on the location in which we're running this analysis for. So if we're running this analysis in downtown Manhattan, we don't want to run a 3-mile buffer from an optimized drive time. We might want to run a different type of analysis, such as running the analysis of the optimal walking time, buffering that walking time or walking route by 500 feet instead of 3 miles, and also creating a 5-minute walking time from the beneficiary's home. So those are the types of variables that, or parameters, that we can change depending on the location in which we're looking at. But those variables allow us to ask the same question of how many pharmacies were passed when filling a opioid prescription at a specific pharmacy. So very simply, that is at a very high level how we're using GIS and spatial analytics to combat the opioid epidemic. We're using GIS and spatial analytics to identify outlier physicians who have a very widespread prescribing habit, as well as finding pharmacies that are not vetting their customers in the right manner that they should. So that concludes our demonstrations. I'm going to pass this back over to Scott, and we are going to hopefully answer some of your questions. And if you guys have any questions, please feel free to reach out to Scott Ward or myself to allow us to work together to combat this opioid epidemic. Thank you.
Thank you, Patrick, and thank you all for joining. This webinar was recorded and will be available on our website probably the week after next. If you have any questions, please make sure to email me at sward@esri.com. We do have some questions. First, we have a question from Annette Gardner. Can you share the slides, Patrick?
Sure. Yes, we can share. We can definitely share the slides. And Annette, if you want to have any more information, I know this is a 30-minute webinar, so we try to keep these talks brief. But once again, feel free to reach out to myself or Scott. And we're also going to post this video, so if you ever want to go back and revisit some of the talking points, you can definitely do that.
Our next question comes from Leon, hopefully pronouncing this correct, Kinsey. Does data used in insights become public? Patrick?
So that's a great question. It depends on your implementation. You can share these insights pages to be public for public consumption, or other people in your organization to look at the insights pages and do their own data analysis. But once you create data and create an insights page, that information is only visible by you. So you have the ability to share it to the public, but initially, and if you want, that can only be visible by you. Also, if you deploy insights behind a firewall, that means that only people within your network can view the data and the analysis that's in insights.
Okay, the next question is from both Greg Sampson and Tony Tao had a similar question. When you were talking about patient 10 having 60 visits, when you went in and did the visits by those doctors, it seemed to indicate he only had 1 visit to each, which would only be 5. Could you maybe fire up the demo again and cover why that was a discrepancy?
Sure. Yeah, I'll do that right now. Yeah, I did notice that, but let me build this link chart one more time. So I use the beneficiary, the doctor name, and the visits. So I'm going to skip doing the symbolizing. I will do the cross filters. I know exactly what I did, and I apologize. So when looking at this beneficiary number 10, I didn't style the links. These links were only doing one-to-one analysis. So when I went back and did selected the beneficiary, the doctor, and then the sum of the visits, this is what gives me the result. So here I can change this just a little bit. So I'm going to change the doctor name to a red color. I'll change this to a blue. So I was visualizing the nodes as the sum of the visits, and I should have hovered over that. But now looking at these links, patient 10 visited Dr. Max Reed 6 times, Dr. John Ship 7 times, Dr. Michelle Smith 8 times, Vita Kuthu 9 times, and Dr. James Miller 31 times. And if we remember, Dr. James Miller was the physician that we identified being the most central in the radial link chart analysis. So that is kind of how we, and I apologize to everybody for kind of skipping over that in, when doing this and trying to stay within the time restraints. I kind of skipped over a little bit too fast, but that's what I did. So I was just visualizing it in the wrong manner.
All right, thank you, Patrick. And next question is ArcGIS Insights a separate software for ArcGIS Desktop?
Yes, it is a separate software for ArcGIS Desktop. Insights is a web application. So if you have an ArcGIS Online organization, Insights is an application that works with ArcGIS Online. It can also connect very similar to your portal for ArcGIS, just being used as a different application. So desktop, so ArcGIS Pro and ArcMap are used for the high-level spatial analytics. Insights is just a different application used for a different analysis to do charting and mapping analytic capabilities in the same location. So yes, it is different from desktop.
Next question is this a dashboard, or I guess maybe can this be configured as a dashboard?
Insights can be configured as a dashboard, but that's not really what Insights is used or built for. So you can create these dashboard views, but Insights is mainly has the capability for the deep data discovery, unlike dashboards. So if you did want a dashboarding technique, I would suggest using Operations Dashboard for ArcGIS. I'm going to pull up a Opioid dashboard. This is Operations Dashboard for ArcGIS, and as you can see, you can have different tabs within the dashboard. So you can use maps and indicators and charts, as we can see here, looking at the number of deaths, the number of overdoses for opioid prescriptions, or just to visualize indicators. So this information can be completely real-time or dynamic. As your data changes, these dashboards will also change.
Next question is, I see online you have a free trial. Which would we choose to accomplish the data results you described today?
So if there is a free trial, that's probably a free trial for ArcGIS Online. That will give you the ability to create these interactive maps. This is a story map, which is a completely configurable template within ArcGIS Online. Insights for ArcGIS, if there is a free trial, that is the application that once again is web-based. So I would suggest reaching out to myself or someone else at Esri to try to get you, suited with the best capabilities for your analysis.
Okay. Next one is, does this tool indicate if various doctors are in the same practice?
So that's probably in result to my Insights page that I built. So these physicians here, this is demonstration data. sharing information on the prescriptions themselves for the beneficiaries is PII information, personable identifiable information, which can't be shared. So the first two workbooks that I created, the opioid deaths and the Pennsylvania physician opioid rates, that was public information published by the CDC and Center for Medicare and Medicaid Services. But this last analysis is demonstration data, so it's not it's fictitious, but it represents the dispersion and the analysis that would go into a real analysis.
Okay. Based on physician specialty, is there a way to calculate what is considered an average number of visits for the population?
Yeah, so within the physician specialty, yeah, there is multiple ways to do that. So here we're looking at the tree chart, but we can also change this chart type to be something like a box plot. So this box plot will allow me to do a histogram type analysis to visualize each of these physician specialties. So as you can see here, if I expand this box plot all the way, we can look at each of these physician specialty types. So here for anesthesiology, we can see that the median total number of prescriptions, or the opioid prescribing rate, is 247 per doctor. We have a upper quartile, upper whisker, and even some outliers here. So some of these physicians here for anesthesiology are extremely exceeding the box plot analysis. So yes, so that type of statistical analysis is capable within the ArcGIS platform.
Excellent. Are there any additional fees associated with the use of Insights?
Insights is I'm not sure of the licensing restraints, but yes, it is another application, another capability within the ArcGIS platform, but it is not of a extreme cost. So I would suggest reaching out to a customer service representative on costing.
And I'll weigh in on that. There's a survey at the end of this. When you quit out of this of our webinar, you'll be asked a number of questions. One of which is that you'd like to be contacted by somebody about how much Insights costs. One more is, can you use other health systems claims data?
Yeah. So whatever data that you can connect to, you can. If you can connect to data or get a download of any data out there, that can be brought into any of these applications for analysis. So it can be brought into Insights for the business intelligence analysis. We can do direct spatial analysis like the network analysis, drive times, or into these dashboarding capabilities.
Excellent. Well, thank you very much, Patrick, for your time. Thank you, everyone, for joining us. Please fill out the survey to help us improve for next year, and also in case you want to be contacted about any of these, any information presented today. Other than that, have a wonderful holidays, and thank you. See you next year.